I'm here with Charles Ornstein, senior reporter at ProPublica. Tell me a little bit about why journalism is so critically important to the healthcare field.
And journalism can help chronicle the changes. It can help expose really gaps in those systems. You're seeing growth of organizations like ProPublica, nonprofit journalism outlets, and other non-traditional journalism outfits that are finding success in an online world where they are adapting, and that the structures that have been built over time within news organizations on the way things have done, they don't exist. We don't have a printing press. So, we don't have to worry about getting our newspaper delivered to hundreds of thousands of doors every day. We can focus on the journalism, and that's really liberating. So I've been covering healthcare for a long time, and Medicine X is really at that crucial, sort of point between clinicians, researchers, and patients.
A lot of Medicine X is focused on the role of technology in medicine. Can you speak a little bit about the role of technology and emerging technologies in your field in journalism?
One is we make available our documents and say, if we're going to refer to a document, we're going to give you a link to that document. You can read it yourself. And if you don't think we're characterizing it accurately, we're not hiding the ball here. Second is we're giving you lots of opportunities to interact with the news. So I've written a whole lot about conflicts of interest in medicine, and so have a lot of other journalists. But one of the things that ProPublica did in a different way than other journalists is we created a database called Dollars for Docs. And Dollars for Docs lets you go type in the name of your doctor and see whether your doctor has a financial relationship with drug companies. We have to give people the ability to customize the news within the broader framework to something that's really interesting and important to them personally.
Are there ways in which the medical field can partner with journalists or learn something from the journalism field?
So the truth of the matter is, yes, data can be used for purposes of investigative reporting, to find fraud, to look for outliers, and we've done that, right? So that's okay. But most doctors are not outliers, and most doctors are not committing fraud. But there are reasons why data can be used to be helpful for patients in a way that is not adversarial. If you are looking to see whether your doctor has experience with a particular procedure, health research shows that doctors who perform surgeries more often are more competent at those surgeries. And if you can see within data that your doctor has experience with a surgery, it will give you greater confidence going into the surgery. So that's not really adversarial, but it's actually helpful for both medicine and patients to have access to that information. And in medicine, there's a strong culture of education and training. At the same time, there's also just a proven gulf between the outcomes of surgeons that have a lot of experience and surgeons that don't. So perhaps in some of those situations you want to pair those surgeons together and in the process of learning, make sure there's the adequate oversight or follow through.